Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for Tennessee, Virginia, and the Appalachian Highlands. As I've pointed out before, we like to follow the week-to-week growth rate. How many more deaths are we seeing this week than we saw last week? And this week in the United States, we've seen a 2.5% increase. It's one of the lowest increases that we've seen, which is good news. Virginia had been coming down very similar to the U.S., and then the last couple of weeks has been a little bit higher, 6.2%, suggesting that there is still continued spread in Virginia. If you look at the average number of cases in Virginia, it grew quickly, then it dropped and grew again, and seems to be leveling off. As I've said before, I'm not a big fan of cases because it depends on how many tests you run. But if you look at deaths in Virginia, it's very much like this bouncing ball, right? It goes up and down, up and down. And in the last month or so, we saw a spike in the number of deaths, and it appears to be coming down, which is good news. But on the other hand, the fact that this continues to go up and down suggests that the pandemic is spreading into different parts of the state. This is all of the counties and areas in Virginia for all the cases that have been reported since the beginning, and now it's going to transition into those that have been reported in the past 2 weeks. And again, you can see this movement towards more rural areas. And hopefully what we're going to see is that the pandemic will eventually have saturated across the state. But until that happens, it continues to be a major public health problem and a major cause of death in our state of Virginia. Tennessee was coming down. It has been more level than Virginia, suggesting there's still continued spread across the state. But its 6.3% weekly growth rate is almost exactly the same as Virginia. Both of them are almost twice as high as the rest of the U.S. or the U.S. overall anyway. In Tennessee, we saw this slow increase and then a rapid growth in number of cases. If you look at deaths, it's been this steady increase and maybe a little bit of drop recently, but not a lot. So again, an evolving pandemic. This is all the counties in Tennessee with the number of cases since the beginning, and then it transitions into those cases just in the past 2 weeks. And again, you can see it moving into the more rural areas of the state. In terms of the Appalachian Highlands, we've seen a continued number of cases, now hitting on 44,000 cases and a 4.8% increase in the past week. If you look at deaths, while the numbers are smaller, the death rate continues to go up, and now hitting almost 750 deaths. That's pretty significant, and an 8% increase in the past week. So remember, Virginia at 6.2% in the past week, Tennessee at 6.3%. Our region, unfortunately, is a little bit higher at 8.2% growth rate. So what this tells me is that Tennessee and Virginia still have a ways to go to catch up to the United States overall, and our region is a little bit behind both of the states. So again, we're still in a major portion of this pandemic. Hopefully we'll start seeing it slow down fairly soon, but it is still growing, still a major public health problem for us. Tennessee has reported 187,000 cases and 2,300 deaths. Virginia, less cases, but 3,000 deaths. And our region, as mentioned, 750 deaths. And I don't want to let this pass without pausing to remind everyone that these are people that are dying from this pandemic disease. So all opinions aside, this is a serious epidemic. It's the third leading cause of death in the United States. It's one of the 24 worst pandemics in human history. Please, we need to continue to take it seriously. A great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let Jan Stork know. As always, I'd like to thank Melissa White and Dara Young for their work in making these videos possible. If you have any questions, comments, concerns, criticisms about these videos, please let me know. I'd be very happy to hear from you and try to address the issues that you might raise. Thank you very much.